Screen. Okay. Yes, good afternoon. Hello, can you hear me?
Good afternoon, sir.
Good afternoon. Okay. Yes. Anyhow, today we'll have a CSF analysis demonstration. Actually, it's a tomorrow class. Tomorrow, Walvekar sir will take his class. A little exchange because he's on leave. Just you can go through what is the importance of CSF cerebrospinal fluid analysis. Usually, it is done in the biochemistry, biochemical parameter analysis to diagnose neurological problems or injuries in the neurological neuritis or any viral or bacterial infections, and even tumors and etc. can be analyzed with CSF cerebrospinal fluid, with the specific fluid which is present in the subarachnoid fluid plexus between the spinal cord and brain. So we'll see what are the important parameters and normal constraints of the CSF and the abnormal conditions, what happened to the CSF, and even important biochemical estimations of the protein and how it helps for the protein and glucose estimations. Even chloride also can be done in the CSF analysis, biochemical analysis. So there will be other parameters also, hematological parameters and microbiological assay also will be done for evaluations or diagnosis of the appropriate problems. Let us see now, next slide. So what is CSF? The cerebrospinal fluid, which is a very clear fluid. That name indicates can be found around the inside the brain and spinal cord. So it is between this one, which protects this internal organs by any injuries. The subarachnoid space and ventricular systems. It is produced in the choroid plexus and provides the basic mechanisms and immunological protection to the brain. It composed of 99% of water, the rest 1% is chemical compositions. It is secreted per day around 500 ml per day secretions, and 3 to 4 hours which is resynthesized and circulate about 120 ml. So see this anatomy and physiology. Some cerebrospinal fluid is present within the subarachnoids space surrounding the brain in the skull and the spinal cord in the spinal column. Total volume about adults will get 140 to 170 ml. Children 10 to 60 ml. Then you go see the structure, and there are some brain parts labeled with all. This is choroid plexus and tentronium cerebrally, fourth ventricular, foramen mesendia, foramen lusk. Then you have aqueduct sylvis, third ventricular, foramen honora, and lateral ventricles. These are the structure of this brain. Then CSF formations. What is how it forms? The cerebrospinal fluid is the liquid that surrounds the brain and spinal cords. So mechanism of formations, there will be it is called selective ultrafiltration of plasma, and it is active secreted by epithelial membrane, and normal blood-brain barriers is important for the normal chemical results of CSF. Let us see next slide. The same, you can go the formations and compositions of CSF. CSF is derived from ultrafiltrations, already we have seen. Plasma ironed by two choroidal plexus. Plexus located in the ventricles of the brain. So next is reabsorption of CSF occurs at the arachnoids villi, which projects in the venous sinuses in the durometer. CSF is produced at the rate of 500 ml per day. The formation and composition of CSF, you can see that protein crossed freely by all transport mechanism, passive diffusions along the concentration gradient, and is also influenced by the molecular weight. So functions, as you know, that every tissue organ requires all the nutrients, waste materials sent out. Similarly, here also physical support and protection to CNS from the trauma, supplying nutrients to CNS, remove the metabolic waste from the CNS. The third point, an intra cerebral transport, neuroendocrine role, and distributions of hypothalamus hormone within the brain. These are the important functions of the CSF. And what are the other importance of these diagnosis by the CSF? So which can be diagnosed by bacterial tuberculosis, fungal meningitis. So which may be viral, and sensitivity or specificity is there. Viral meningitis, SAH, CNS, all these problems, meningeal malignancy, we can use for diagnosis of this CSF. Even intracranial hemorrhages, viral encephalitis, subdural hematoma, so can be during these conditions. This is used, CSF analysis used. Clinical indications, similarly already I told you, CSF performed in the case of suspected case, mainly in the CSS infections, all these meningitis and encephalitis, and even malignancies, immunity disease, multiple sclerosis, etc. You can see that. Indications for the lumbar puncture. Can you see this slide? Can you see this slide? Hello? Hello?
Yes, sir.
Yes, sir.
I don't know what is going on there. Pictures, just you have to respond. So, indication for lumbar puncture, all these suspicious case of meningitis, suspicious all subarachnoid hemorrhages, suspicious suspicion of central nervous system disease, Guillain-Barré syndrome, carcinomatous meningitis, therapeutic relief, all these things we can do the indications of lumbar puncture in these cases. There will be contraindications also. Lumbar puncture is a very sensitive procedures. So for the aspirations or collections of the CSF, see the next slide. Here you see the contraindications of lumbar puncture. Increase there to be intracranial pressures and unidentified origin. Suppose if you have any problem, then it will be a pressure result as there is damages. Can cause the cerebral herniations. Exception therapeutic use of the lumbar punctures to reduce the ACF. These even infections is possible. Skin infection at the puncture site may cause the sepsis. So abnormal respiratory pattern, hypertension with bradycardia, and deteriorating the consciousness. So these are the important to this the limitations to see contraindication. Vertebral deformities, it happens in the hand of an inexperienced anybody is not properly done the procedure for collections of CSF. It's very directly it goes to infection to the brain, then there will be possibilities of all complications. Even bleeding, coagulopathy, decrease the platelet count. So all these complications already I told you. Post lumbar puncture, headache, all introduction of infection of the spinal canal, subdural hematoma, failure to obtain CSF, dry tap, herniations, all these things already used in the earlier. Again, it adds one or two points. Indication for CT prior to lumbar puncture, these are in suspicious case of meningitis, which the patient comes with unconscious state or stiffness in the neck. All these many symptoms, manifestations you will find with long-term infections, untreated infections. So went to brain, blood-brain barrier test, and this leads to the unconscious. So then this when we have to do patient who are older than the 60 years, patient who are immune compromised, patient with bone central nervous system legends, patient who have had seizures within 1 week of the presentation, patient with a normal level of consciousness, patient with focal findings on neurological examinations, patient with papilledema seen on the physical examinations, with clinical suspicious case. This is the CT we have to do it prior to LV. So lumbar puncture, the patient is placed in a lateral positions with the knee bent in full flexible up to the chest. Diagram next slide it is shown. So we have to one side you have to lie down and brings your all the knee and bend towards the chest. And that is called fetal positions. Sit and bend positions also possible. Even sitting also can connect. The introductions of 1% of windowsing into the subcutaneous space and insertions of the spinal needle into the subarachnoid coracoid space at the L3, L4 or L4, L5 intercostal space inserted until the second give the subarachnoid space. Remove of the stylet of the needle in order to collect the fluid. Wrong. Removal of the needle and stylets of the needles in order to collect the fluids. Let us see the 4 and L3 third quadrant vertebrates, and fourth there the needle is used. Cerebrospinal fluid can be collected. These are the other pictures. You can see that it is sensitive procedure. Experienced person has to do these collections. Otherwise, there is a complications. You have seen in the earlier slides. There is a problem. Spinous process. The needle is used. On this vertebral has to identify very sensitive procedure. So appropriate reason we have to prick this one needle has to use. Even sitting position it is there, and sleeping positions can be also can collect the CSF. See here, so it is hardly 5 ml collections. It comes by drop or drop in the given time. So we have to collect a small amount of CSF. Collection and processing, lumbar puncture, systemic puncture, and lateral cervical punctures, even shunts and cannulas. Opening pressure, the pressure has to maintain between this one, otherwise intracranial pressures, there is a contraindication. Approximately 15 to 20 cc. Only 5 ml is sufficient for biochemical analysis. This other purpose, it is 15 cc fluid is collected for all microbiological and cell counts and everything. Process within 1 hour without you have to keep it in the refrigerator. 3 tube you have to set up it depending on that infections and whatever is prescribed by the physicians. So requirements, even it requires microbiological assay or cell counts and cyto chemistry, cytological assay. So chemistry and immunological also you can analyze microbiology and cell count differential cytology assay. So routine lab test, you know already, opening of CSF assay, microscopic examination, total count, all these things they will do. So even only in biochemical, glucose and protein we use for this. Optional culture, gram stain, all these they will discuss in the microbiology and pathology. They will discuss about what are their procedures of gram staining, all different abnormalities in cancer cells and other cells, bacterial infections, viral infections. They can be identified histopathological sites. So culture also they will do it. Routine laboratory, CSF assay, all these will do chemical investigations in our biochemical analysis. So normal, whatever you should know the normal, what is CSF, how it is, what is the pH, it is 7.4 to 7.6, between you will get the pH. So clear, it is very clear, colorless, any problem within the early collections and the needles and any blood contamination, it changes the color. And abnormalities also it changes colors. In jaundice it will become another different color. Here normally it is very clear. Daily secretions you will get the what I have told in the 500 ml per day secretions. Specific gravity is around 0.05 to 16 and 1.007. Some books it will be 1.005. So whatever you can take in the range 1.005 to 1.007. Normal microscopic examinations, lymphocyte, all we can find. So these are the normal concentrations of the CSF, protein, glucose, chloride, calcium, phosphorus, magnesium. Still other parameters are there, enzyme parameters. So we can see the next slide also. See a protein, whatever 15 to 45 milligrams per deciliter, glucose 50 to 80 milligrams. So chloride 130. 115 to 30 millimoles per liter. So even see calcium and other parameters. We all already I told you only in the air is partial pressure of oxygen 40 to 44 mm. The normal total solids whatever you have taken 0.85 to 1.70 grams per deciliter. So already I told the urea, uric acid additional parameters, creatinine, ammonia also can estimate, cholesterol also you can see that very normal range is just 0.2 to 0.6 milligram per deciliter, not ectoplasma cholesterol, that is 150 to 200 milligrams. Here is one CSF this much. Only diagnostic purpose usually will do in the biochemical protein and glucose, chloride also can estimate. Composition normal CSF, sodium, potassium also say it's not usually prescription should not be there. Only chloride say they will recommend for analysis. You see CSF analysis color already clear. Your turbidity you will get in case of bacterial meningitis. Even yellow xanthochromatis, yellow, orange or pink discoloration is more than 90% of chloride and hemorrhages, physiological newborns. Yellow you will find in the RBC breakdown, high bilirubin level, high protein levels, you will get 150 milligrams per deciliter, or any infections you can take, tubercular, fungal meningitis, you will get the yellow colors. So pink RBC breakdowns, orange RBC breakdowns again, high carotenoids intake. So green you will get hyperbilirubinemia, virulent CSF bacterial infections. Then brown also sometimes you get the meningeal melanomatis. This again same slide, color is clear. Turbidity will get bacterial infections, all these things. Same, what you will get the W cell and pus cells suggestive of the CNS infections. So probably some ideas it gives on the physical examinations of the sample. So not exactly, but can guess. Suggestive hemorrhages, subarachnoids, or all these traumatic taps. Red brown colors, blood, yellow colors, jaundice, xanthochromatomia, hemoglobin breakdown pigments in CSF, this thing physically. Microscopic also examination, normal total RBC count or increased neutrophils, increased lymphocytes, and some other cell parameters also can be analyzed. Here RBC, normally CSF is blood-free. RBCs in CSF, all hemorrhages and malignancy, even in which will be excluded in the chemical examination of CSF. In addition to the major ion, CSF contain other component oxygens, sugars, glucose, fructose, lactate, proteins, all that, etc. Amino acid, urea, ammonia, even enzymes also present, vitamins, some other parameters, hormones, lipids are there. So in our laboratory, we'll do only estimation of glucose and proteins, major concentration for to CSF will analyze in biochemical parameters. Normal CSF glucose 50 to 70 milligram per deciliter, as when you compare it with the blood glucose, where you will get the 110, 100 to 110. So in the here you will get the acute CSF glucose concentration may falsely known in the presence of hypoglycemia or into incorrectly interpreted as a normal and the patient is hyperglycemic. Accordingly, CSF glucose should be always compared with the simultaneous plasma glucose that is drawn prior to lumbar puncture. Normal CSF glucose and plasma glucose ratio approximately 0.6 to 0.7. Glucose 45 to 80 is taken in normal range in any alterations which indicates the helps for the diagnosis. We'll see in the next slide. So need to be no value. The increases when it increases traumatic tap and hyperglycemia. The increases usually. So it is helpful for a decreased level definitely. So it helps for the most of the diagnosis. Increased level may not be much specific. Hyperglycemia may be one of the so it will very difficult to interpret other conditions. So here hypoglycemia and conditions usually meningitis, tumors, all type of meningitis, bacterial, tuberculosis, or fungal. So tumors, in these conditions glucose level decreases than the normal. But CSF glucose normal in viral, but not other conditions, CSC, bacteria, and tumor as compared to this one. It is normal. So the glucose estimations we can done with Godford method only is similar to the glucose plasma blood glucose estimations. Here also we have to take the 3 PPT, 3 test tubes. Then you have to label them into blank standard already were known and test. So there are the solutions, reagents, working reagents are there, reacting reagents, and standard solutions are there. Then CSF sample. All you have to take in the blank and equal value you have to make it. So blank 1.5 ml and 0.02 ml distilled water you make it 2 ml. Similarly, standard and standard solutions and glucose working solution it will become 2 ml. So I regularly test 1.5 ml and CSF sample. So you have to incubate water bath for 15 minutes. Then you have to estimate in the colorimetrically you can estimate a particular parameter. CSF glucose level is normalized before protein levels and other things. So useful parameter processing response of the treatment. So useful. The CSF glucose, let us see, this increase is no clinical significance. If increase, there is possibilities in other infections, so increases. So, but here is major decrease is the very significant useful for diagnosis. Meningitis, bacterial or fungal infections, and which is used. Tumors involved in the meninges, subarachnoids, hemorrhages, or cerebral amoebiasis. These are useful for the estimation of blood glucose. And CSF protein is another parameter very useful for the even all infections. Here normal 15 to 45 milligrams, mostly albumin. Majority of CSF proteins is derived from the plasma by ultrafiltrations. So these analysis, you can see plasma derived, so many other subfractions of the proteins, plasma proteins, transparenal, albumin, all these things you can see there. Analysis total protein non-specific marker of the disease. There is a method of laboratory method on TCA trichloroacetic acid or SSA sulfosalzinic acids and sodium sulfate for the precipitation reactions of protein. The thermometer methods can estimate. This is simple and rapid, no specific instrumentations. 300 different other proteins can be estimated. So have been isolated from CSF in the using two-dimensional electrophoresis and silver staining. So in the specific disorder, anything protein, any protein we have to isolate, then we have to use the electrophoresis technique. And this is two-dimensional way we have to estimate and get the subfractions of the proteins. Quantitative, there will be quantitative and qualitative. We can estimate qualitative also. We can do it. That is called Pandey's test. This is what Pandey's reagent, what it is contained. 30 gram of phenol and 500 ml. So we can qualitative. We can estimate. So quantity is very important for our assay. Turbidimetry method in the presence of sulfosalicic acid or sodium sulfate or protein yield to inform turbidity which absorbs the maximum at 520 nanometer of the green filter or directly proportional to the concentration of protein can be estimated. What we will do in the plasma, blood, what we will do it BCG and bioreactor test. Here is the turbidimetry method. CSF protein reagent, all these compositions used standard soluble fractions and 100 micrograms per liter, so which is prepared and used for the estimation. See, similarly, what procedure routinely will do in the manual method, blank standard test. Again, we have to make it 2 ml by using the CSF reagent, distilled water, CSF protein standards. Now, all these things we have to mix well and keep it labeled and standard test and all these things. Then we have to estimate. So condition for associated with increased CSF total protein. This is very important. Total protein levels are increased. Increased blood CSF permeability, meningitis, bacterial, fungal, and tuberculosis. Already we know hemorrhages, endocrine disorder, mechanical obstructions, or neurosyphilis. Sometimes we'll get the false elevations of protein occurs in the CSF is contaminated with blood. So during the process of collections, this can be corrected by all these. This can be done by there is a procedure for deducting 1 milligram per deciliter of protein for every 100 RBC. This is we'll do in the lab. So, although there are several causes for the high protein levels are increases. Analysis of contaminated blood from the traumatic tap. So increased permeability of the epithelial membrane, even CNS bacterial fungal infections, cerebral hemorrhages, increased production by CNS tissue, as in multiple sclerosis, all these conditions, you can see that neurosyphilis, and then subacute sclerosis, encephalitis, Guillain-Barré syndrome, etc. We can see multiple sclerosis, mononuclear cell pleocytosis, increase intrathecal productions of IG, all this in the what we can estimate it in the other sclerosis conditions in the what in the other conditions going on. So the diagnosis of various viral infections and all these things. Even COVID also we can do it this IgG index ratio, IgG and albumin, all CSF, the ratio of the IgG and albumin in the serum. All monoclonal, oligoclonal bands, you can see the measurement. Paired serum sample studied, extraperipheral, example, non-CSF production of oligoclonal bands. Albumin, there are other albumin and immunoglobulins estimate. So it helps for diagnosis. It's very important for the colonal bands can be identified, monoclonal, oligoclonals, all these things. Electrophoretic band can be used. Normally 4 bands, albumin, transferrin, all these things you can have oligoclonal bands, myelin basic proteins, these things you will. So we'll process in the our laboratories in clinical biochemistry for diagnosis of various plasma proteins, subproteins by the hemoglobin fractions. We can estimate analyze by electrolysis technique. This is another condition, Guillain-Barré syndrome. Also, will use the albumin cytological dissociations. Even our analysis also helps for the electrophore technique we can analyze. So this is the chart is what it is requires for commonly. So one should know the basics aspects of the CSF, what normal condition, what happens in the appearance, pressure, WC, and protein and glucose and chloride. So you can see in the all these conditions. So some probably it gives some clue for so physicians and even or in laboratory working faculties will get the ideas whether it is normal or abnormal conditions by referring this slide. This is all the aspects of what usually we do in CSF, protein and chloride also we can by silver chloride methods. So silver nitrate we are titrating, the CSF we are estimating chloride also. So usually we will see the protein and commonly used protein and glucose is estimated. So this completes. There are other aspects also there. So not for you can go for hematological and microbiological, let's say different histopathological side, how it helps for diagnosis and other things. So this is our interpretations, what we have to do in the laboratory with CSF analysis, chemical compositions, and what is the principles of protein and glucose analysis, and when increase, decrease. This is today what any questions, anything you want to ask, you can ask. Any queries? So actually, once you specialization, if you take biochemistry or any researchers, and then if you are interested, then you will get the all ideas. So how to do the CSF analysis. Then interpretations, the physician will do it with based on the values, whatever we will given, and physical examinations, and then other differential diagnosis of the abnormal conditions of the patients. Okay. Good afternoon. Hello. 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 Can you hear?